This conference will now be recorded.
Okay, today's topic is infant and young child feeding. Do you heard about IYCF? IYCF. Any one of you? So there are guidelines for infant and young child feeding practices. Okay. So infant and young child feeding is a set of well-known and common recommendations for appropriate feeding of newborn and children under 2 years of age. Okay. Optimal IYCF practices are early initiation of breastfeeding, that is immediately after birth. We should start breastfeeding within 1 hour of birth. Exclusive breastfeeding means only mother's milk, no other foods or fluids, not even water. But infant can receive ORS drops, syrups of vitamins, minerals and medicines when required. Other than breast milk, nothing is given for 6 months. This is called as exclusive breastfeeding, that is up to 180 days of life. Timely introduction of complementary feeds, solid, semi-solid or soft foods after the age of 6 months is called as complementary feeding. Continued breastfeeding for 2 years or beyond. Age appropriate complementary feeding for children 6 to 23 months while continuing breastfeeding. Children should receive food from 4 or more food groups, that is grains, root, tubers, legumes and nuts is one group, dairy products is the second group, flesh foods like meat, fish and poultry is the third food, egg and vitamin A rich fruits and vegetables is another group. Okay, and other fruits and vegetables and fed for a minimum number of times, that is 2 times for breastfeeding infants between 6 to 8 months of age, and 3 meals, that is 3 times for breastfeeding infants between 9 to 23 months of age, 4 times for non-breastfed children, because we have to supplement whatever is not getting from breast milk. So we have to give more number of feeding, for more number of feeds for non-breastfed children between 6 to 23 months of age. Okay. Active feeding for children during and after illness. We should not stop feeding in children. You should not say to stop feeding while child is having diarrhea, while child is having fever. If child is able to eat and able to tolerate feeding, we should always continue feeds. Otherwise, along with the illness, malnutrition or the starvation can aggravate the illness. So we should not stop feeding at any cost unless there is some intolerances like lactose intolerance or something else. Okay. So IYCF technical guidelines includes, first one is breastfeeding, second is complementary feeding, third one is HIV and infant feeding, and special situations. Breastfeeding, it should be initiated and promoted to mothers and other caregivers as a gold standing feeding option for their babies. Okay, it is the gold standard for feeding for a newborn baby. Antenatal counseling individually or in groups. Okay, and in baby breastfeeding and all these things should be counseled to the mother prior to delivery itself. Antenatal counseling. Okay, and in a organized way, maternal facilities should contain messages regarding advantages of breastfeeding and dangers of artificial feeding. Okay, the objective should be prepare expectant mothers for successful breastfeeding. If you don't counsel antenatally, they may not be able to understand the importance of breastfeeding, and may not give proper duration also breastfeeding. So we should always encourage them and teach them. Breastfeeding must be initiated as early as possible after birth for all normal newborns, including those born by cesarean section. Previously, they used to say in cesarean section cases up to 4 hours is allowed, but now the rule is, a dictum is, we should start within 1 hour after birth for even cesarean section cases. Normal delivery or even cesarean section cases, we should always start breastfeeding within 1 hour of life. In case of operative birth, the mother may need motivation and support to initiate breastfeeding within the first hour. So we should always motivate the mother. The mother may say, I can't move, there is pain in the abdomen or something else, but we should always counsel them that breastfeeding will reduce your pain. So we should always counsel them and try to give encourage breastfeeding. Skin to skin contact between the mother and the newborn should be encouraged by bedding in the baby and mother and baby pair, infant mother dyad we will call it as. So bedding in or rooming in. Okay, the method of breast crawl can be adapted for early initiation in case of normal deliveries. Nowadays, in normal deliveries, babies is being delivered onto mother's abdomen so that baby can do what you call it as breast crawl. It tries to find the breast nipple to suck. Okay, mother should communicate, look into eyes of the baby, touch the baby, and cares the baby while feeding. The newborn should be kept warm by promoting kangaroo mother care, that is skin to skin contact, and promoting local practices to keep the room warm. Okay. Colostrum. What is colostrum? It is the first fore milk that comes during immediate postpartum period, that is in the first 72 hours to 1 week. Mother can have this colostrum, which is rich in all immunoglobulins, immune rich and nutrient rich colostrum. Some may feel that colostrum is the waste milk and we may discharge. Some communities have that notion and feeling, so we should always say them that colostrum should not be discarded, we should be giving it to the baby. Okay, so that baby's immune system and other anti-disease fighting capability is good in breast milk during this colostrum feeding. Colostrum milk secreted in the first 2 to 3 days may not be discarded, and no prelactial feeds such as some outside cow's milk or breast milk, all these things should not be given to the newborn. Only mother's milk including colostrum should be given. Baby should be fed on cues. On cues means baby may be crying for feeding or doing some suckling movements or suckling sounds, then baby should be feeding. The early feeding cues include sucking movements, sucking sounds, hand to mouth movements, rapid eye movements, soft cooing or sighing sounds, lip smacking, these sounds, and restlessness. Okay, etc. Crying is a late cue and may interfere with successful successful feeding. Okay, crying is a late cue. Okay, we should not allow the child to cry for the feeding. We should always look at how baby is suckling movements, sounds, mouth, hand to mouth movements, rapid eye movements, soft cooings and sighing sounds, lip smacking and restlessness. All this. We should not allow child to newborn to start crying. Okay, periodic feeding should be practiced only on medical advice. Exclusive breastfeeding should be practiced from birth till 6 months requirements. Okay. After completion of 6 months of age, with the introduction of optimal complementary feeding, breastfeeding should be continued for a minimum of 2 years. We should not stop breastfeeding till 2 years of age unless mother is not able to give or any other problem is there for the infant and baby. Okay, and beyond that, depending on the choice of the mother and baby, they can continue, but up to 2 years now is now dictum. But complementary feeding should be started from 6 months because mother milk is not enough to maintain an adequate amount of calories and protein and fats, all these nutrients beyond 6 months of life. Understood? So we should always start complementary feeding while continuing breast milk till 2 years of age. Even during the second year of life, the frequency of breastfeeding should be 4 to 6 times in 24 hours, including night feeding. Mothers who work outside should be encouraged to continue exclusive breastfeeding for a minimum of 6 months. This is called as exclusive breastfeeding by expressing milk for feeding of the baby while they are out for work. Okay, expressed breast milk can be given to them while mother is out for work, and initiating the infant on timely complementary feeds. They may be encouraged to carry the baby to a workplace wherever such facility is existing. The concept of Hirkanis room may be considered at workplaces. Hirkanis room is a specially allocated room at the workplace where working mothers can express milk and store in a refrigerator during their work schedule. Understood? Hercules room is a specially allocated room for breastfeeding mothers at the workplace. Okay, where they can express the milk and store it in refrigerator. Like nowadays, even software companies or any major malls are also providing this Hercules rooms. Probably in cities. not in towns yet, but cities. Every such mother leaving the maternity facilities should be taught manual expression of breast milk. Okay, working mothers should be knowing about this manual expression of breast milk. At every health visit, the harm of artificial feeding like bottle feeding, okay, should be explained to the mothers. Inadvertent advertisement of infant milk substitute in the health facility should be avoided. Okay, we should not prescribe the milk substitute unless mother is not able to give breastfeeding due to various maternal illness. Mother is in the intensive care unit and there is no provision of any other milk until mother recovers. So then that is the time we should ask them to get some artificial infant milk formula. Otherwise, don't start on day one unless indicated on artificial feeding like infant milk formula. Okay, all efforts should be taken to provide appropriate facilities so that mothers can breastfeed babies with ease, even in public places. Understood? And there should be these rooms available around in the public areas also, public places also, so that mothers can safely feed their babies. Adoption of latest WHO growth charts is recommended for growth monitoring. Complementary feeding. Appropriately thick complementary feeds of homogeneous consistency made from locally available food should be introduced at 6 months completed. Okay, after completion of 6 months. Don't say that before 6 months. Some people may ask, where can I start solid foods or semi-solid foods? You should say no. Till the 6 months completed period, your baby is not ready to feed semi-solid or solid foods. Okay, but breastfeeding to be continued. Okay, it should not be stopped. This should be standard and universal practice. During this period of breastfeeding should be actively supported, and therefore the term weaning should be avoided. We should not use the term called weaning. We should always use only the term called complementary feeding. To address the issue of small stomach size, each meal must be made energy dense. We know baby may not eat much of the complementary foods. Whatever little you are giving, it should be energy rich and energy dense. How will you make it energy dense? By adding ghee. Almost every house, majority of the house, unless below the poverty line, can have this ghee. Okay, they can add this to the whatever foods we are giving, like rice, dal, and the ghee combination can be given. In some things like milk, later on sugar can rather than sugar, jaggery can be added. All these are energy dense foods. Okay, to provide more calories from smaller volumes, food must be thick in consistency, thick enough to stay on the spoon. It should not run off like water. Okay, it should be thick enough. When the spoon is tilted, it should be thick enough to hold the spoon. Food can be enriched by making a fermented porridge, use of germinated or sprouted flour, and toasting of grains before grinding. We should always grind this after drying them. Okay, we should be always roast them and toast them and grind them and keep it in a dry bottles, cans, so they can stay for at least 1 to 2 months period. We can cook it whenever a child is required by adding some water. Okay, parents must identify the staple home food comprising of cereal pulse mix. That is nothing but cereal is rice, pulse is dal. Okay, such mixture we should be used as they are fresh, clean, and cheap, and make them calorie and nutrient rich with locally available products. Iron fortified foods, iodized salt should be used. Vitamin A enriched food should be used, are to be encouraged for feeding. Okay, as the babies start showing interest in complementary feeding, the variety should be increased by adding new foods in the staple food one by one. Easily available, okay, cost effective, seasonal, uncooked fruits, green and other dark colored vegetables, milk and milk products, pulses, legumes, animal foods, oil, bar butter, sugar bar, jaggery must be added in the staple foods gradually. Okay, one by one, we should be introducing all these foods into the, by 1 year of age, the child should be able to eat whatever it is being cooked at the house in semi-solid state, not in solid state. Okay, may not be everything they cannot take in the solid state. Junk food and commercial food, ready-made processed foods from the market like tinned canned foods, cold drinks, chocolates, crisps, and health drinks, bakery food should be avoided at any cost. We should not give all these things to this breastfeeding as well as complementary feeding children. Okay, they will not eat all the nutrient rich. No, they will eat junk food only. Giving drinks with low nutritive value such as tea, coffee, and sugary drinks should be avoided. Which there is no nutritive value in this tea and coffee. Should not be prescribed or given. Hygienic practices are essential for food safety during all the involved steps like preparation, storage, and feeding. Practices of responsive feeding. What is responsive feeding? Young children should be encouraged to take feed by praising them and their foods. We should always encourage them to take certain food. If they take it properly, we should always encourage them by giving some rewards. You have nicely eaten. So because like beyond 1 year, they can understand what you are doing and all. They can understand. So you can reward them in certain ways. Self-feeding should be encouraged despite spillage. In a beyond 1.5 years, we should always encourage the child to eat self-feeding. Despite spillage, even though they throw the food surrounding, we should keep a wide bowl with food in it and a spoon in it. So ask them to try to eat. They will eat, but with spillage will be there. We should not scold them. Each child should be fed under supervision in a separate plate to develop an individual identity. Forced feeding and threatening the child and punishment interfere with the development of good and proper feeding habits. We should not threaten the child. Okay, a skilled help and confidence building is also required for complementary feeding during all health contacts and also at home through home visits by community health workers. Consistency of feed should be appropriate to the development readiness of the child in munching, chewing, and swallowing. Okay, it should be appropriate, like semi-solid to solid. Food with which can pose choking hazard, like nuts. Understood? Like badam, groundnut, or all these solid foods, and should be avoided. We should make them into a different form, like semi-solid or paste form, and then we can give them. Introducing of lumpy or granular foods and most taste should be done by around 9 to 10 months of age, because their taste buds also develop by this age. We should always introduce some granular foods also and taste also. Okay, daily we should not give idli to the baby. All varieties of breakfast should be given, and different types of vegetables also should be cooked. Missing this age may lead to feeding fussiness. If you don't try all these things at this age, later on they may be interested in eating only certain foods. They may not try to eat also certain types of food. So we should always try early only. And source of mixtures, grinders to make food semi-solid but pasty should be strongly discouraged after this age. Because if it is pasty and semi-solid beyond 1 year of age, they don't want to chew it. Okay, they want something solid, little solid to crush it, because they will get teeth. They want to eat it. So 6 to 8 months of age, energy needed is 200 kilocalories. Texture should be start with thick porridge, well mashed foods. Frequency should be 2 to 3 meals per day, including breastfeeding. Okay, and snacks should be offered 1 to 2 times. Average amount of each meal start with 2 to 3 tablespoons, increasing to half spoon to 50 ml of cup. Iron required is 5 milligram per day. Okay, and amount of raw green leafy vegetables required is 25 grams per day. 9 to 11 months, 300 kilocalories. Finely chopped or mashed foods should be given. 3 to 4 meals, including breastfeeding, plus 1 to 2 times of snacks. Half of a 250 ml cup average amount of meal should be, and iron is 5. 12 to 23 months, 550 kilocalories per day we should give. Family foods chopped or mashed if necessary. 3 to 4 meals plus breastfeeding. Depending on the appetite, offer 2 snacks per day. 3/4 to 1 250 ml of cup bowl should be used, average amount, and 9 milligram of iron should be used daily. Okay. If baby is not breastfeeding, give in addition 1 to 2 cup of milk per day and 1 to 2 extra meals per day. Understood? If the child is not breastfeeding at this point of time, Give 1 to 2 cups of milk per day extra and 1 to 2 extra meals per day. The amount of foods included in the table are recommended when the energy density in the meals is about 0.8 to 1 kilocalorie per gram. If the energy density of meals is about 0.6, the mother should increase the energy density by adding ghee or other energy dense rich foods. Okay. Iron requirement is based on 5% bioavailability from cereal pulse based diets. HIV and infant feeding. Exclusive breastfeeding is the recommended infant feeding choice in the first 6 months of age. Irrespective of whether the mother or infant is provided with antiretroviral drugs for the duration of breastfeeding, exclusive breastfeeding is recommended. Mixed feeding should not be used. It will increase the risk of transmission of virus from breast milk to baby. We should not encourage mixed feeding. We should always encourage exclusive breastfeeding. Situation 1. If mother is on ART, antiretroviral therapy for her own health, started before or during pregnancy, maternal antiretroviral therapy significantly reduces the HIV transmission through breastfeeding. So infant born to these mothers are advised 6 weeks of nevirapine, okay, for breastfeeding infants, or 6 weeks of zidovudine, okay, to reduce the risk of early postnatal transmission. Understood? So when mother is on antiretroviral therapy and gives birth to a baby should be given 6 weeks of nevirapine therapy to reduce the transmission. Once even though little amount transmitted also, it will be get killed by this nevirapine syrup. 6 weeks of zidovudine or nevirapine for non-breastfeeding infants. Okay. In this group of infants, breastfeeding would provide all the benefits while eliminating replacement feeding associated morbidity and mortality, with a high reduced risk of transmission. No additional drugs interventions are needed for these infants. Situation 2. Mother is not on any antiretroviral therapy but has been started on ARV prophylaxis during pregnancy, that is continued during lactation. For this group of infants, again, breastfeeding is associated with reduced risk of HIV transmission by the ongoing ARV prophylaxis. Okay, and the feeding option of choice. We should always encourage still exclusive breastfeeding only. If a woman receives azidothioridine, this is zidovudine, during pregnancy, the daily nevirapine is recommended for her child from birth until 1 week after the end of breastfeeding period. We should continue it. Okay, or if the mother received a 3-drug regimen during pregnancy, starting from as early as 14 weeks of gestation, and continued on triple therapy, it is recommended till 1 week after the end of breastfeeding period. Okay, you should continue ART to the mother. Situation 3. If mother is on ARV prophylaxis to cover period of lactation is not available to the HIV infected woman, still exclusive breastfeeding is still recommended unless conditions suitable for replacement feeding are met. Okay, affordability, feasibility, all these criteria should be met. This recommendation is based on the evidence that exclusive breastfeeding is associated with reduced mortality over the first year of life in HIV exposed as well as unexposed infants as compared to mixed and replacement feeding. So always encourage exclusive breastfeeding only, whatever is the situation. Okay. Replacement feeding criteria is safe water and sanitation must be available. Mother or caregiver can reliably afford to provide sufficient replacement feeding, means buffalo milk or formula feeding they should buy and give, no, so that affordability should be there. Should be prepared, able to prepare clean in a clean manner and safe manner, so that it reduces the risk of diarrhea and malnutrition. Mother and caregiver can give it in a fix for first 6 months exclusively give replacement feeding, and family should be supported for this practice. The mother or caregiver can healthcare that offers comprehensive child health services. Okay, they should be supported by this comprehensive child health services. Replacement feeding options are locally available animal milk, commercial infant feeding formula, wet nursing when culturally accepted. Means wet nursing means to by some other mother. When the infant is HIV infected, if infants and young child are known to be HIV infected, mothers are strongly encouraged to exclusive breastfeed for the first 6 months of life and continue breastfeeding as per the recommendations for the general population, that is up to 2 years or beyond. Okay, Already child is infected. The child should not die of diarrhea, pneumonia, all these problems due to lack of breastfeeding. So we should always tell them to exclusively breastfeed. HIV infected women who opt for replacement feeding or in situations where breast milk is not available for infants like maternal death or sickness, twins, etc. Okay, they should opt for replacement feeding. The babies should be given locally available animal milk like pre-packed processed milk or fresh animal milk is easily available, economical, culturally acceptable in comparison to commercially feeding formulas. Commercially infant feeding formulas, while offering the advantage of a standard composition, is expensive and often carries a higher risk of bacterial contamination. However, commercial infant formula may be also be used for replacement feeding when it is preferred by the family and feasible and affordable. In certain areas of India where wet nursing is culturally accepted, women 0 to 6 months old infants, HIV infected women, in commercially and locally available milk formula, available animal milk, wet nursing, exclusive breastfeeding, commercially infant formula are the options. Women with HIV status or status not known, exclusive breastfeeding only. Feeding in other special situations. Feeding during sickness of an infant. Feeding during sickness is important for recovery and for prevention of undernutrition. Okay, during illness, if you don't feed, they will go into malnutrition also properly. Okay, even sick babies must mostly continue to breastfeed, and the infant can be encouraged to eat small quantities of nutrient-rich foods, but more frequently and by offering foods that a child likes to eat. After the illness like diarrhea, the nutrient intake of the child can be easily increased by increasing 1 to 2 meals per day. Okay, for a period of about 1 month. Okay, whatever child is not able to eat during the illness, we can increase in the next coming month by increasing 2 meals per day. Okay, so the child will recover from that by offering nutritious snacks between the meals, by giving extra amount of each meal, and by continuing breastfeeding. Infant feeding in maternal illness, painful and or infective breast conditions like breast abscess and mastitis, and psychiatric illnesses which pose a danger to the child's life. Example like postpartum psychosis, mother will be psychotic after birth of the baby, we should be keeping the baby away from the mother. So schizophrenia, okay, maybe temporary cessation, may need a temporary cessation of breastfeeding. Treatment of primary conditions should be done, and breastfeeding should be started as soon as possible after completion of treatment of these conditions. So understood. Chronic infection like tuberculosis, leprosy, or maternal medical conditions like hypothyroidism needs treatment of the primary condition and do not warrant discontinuation of breastfeeding. Understood. Tuberculosis, leprosy, or medical condition like hypothyroidism does not require discontinuation of breastfeeding. Only maternal psychosis or schizophrenia. Breastfeeding is contraindicated when mother is receiving anti-neoplastic drug, means cancer drugs, immune suppressants, anti-thyroid drugs like thioracil, amphetamines, gold salts, etc. Only then only we should stop breastfeeding. Breastfeeding may be avoided when the mother is receiving following drugs: atropine, reserpine, psychotropic drugs, other drugs like antibiotics, anesthetics, antiepileptics, antihistaminic, digoxin, diuretics, prednisolone, propranolol are considered to be safe for breastfeeding. We should not stop breastfeeding. Infants feeding in various conditions related to the infant. Breastfeeding on demand should be promoted in normal active babies. Okay. However, in different difficult situations like very low birth weight baby, sick baby, or depressed babies, alternative feeding are used on neuro, maybe can be based on neurodevelopmental status. These include feeding expressed breast milk through nasogastric tube or intragastric tube, or using a cup and spoon. For a very sick baby, expert guidance should be sought. Gastroesophageal reflux disease should be treated properly by thickening the complementary feeds, frequent small feeding, and upright positioning for 30 minutes following feeding. Understood? During emergencies, priority health and nutritional support should be arranged for pregnant and lactating mothers. Donated or subsidized supplies of breast milk substitutes should be avoided. Donation of bottles and teats should be refused, and their use is actively avoided. We should not donate any breastfeeding bottles or not no, artificial feeding bottles. Okay. Feeding preterm or low birth weight babies. All low birth weight babies, including those with very low birth weight, should be fed breast milk only. Low birth weight infants who are able to breastfeed should be put to the breast as soon as after birth. If unable to suck, these babies should be fed with express breast milk using a katori or spoon. Ugugin under katori and okay. Low birth weight infant should be exclusive breastfeed until 6 months, that is 180 days of life postnatal age. Low birth weight infants who cannot breastfeed and need to be fed by an alternative oral feeding method should be fed by cup or spoon or as prescribed to the pediatrician. During emergencies, priority health and nutritional support should be arranged for pregnant and lactating mothers. Donated or subsidized supplies of breast milk substitute should be avoided. LBW infants should be given 10 ml of milk, 10 ml per kg of enteral feeds, preferably expressed breast milk, starting from day 1, with the remaining fluid requirement met by IV fluids. LBW infants, including those with VLBW who cannot be fed mother's own milk, should be fed with donor human milk. Understood? 10 steps to successful breastfeeding are: every institute should have a written breastfeeding policy that is routinely communicated to their healthcare staff. This is the important question to you also. 10 steps to successful breastfeeding. Train all healthcare staff in necessary skills to implement this policy, written policy, how to implement also to be trained in it. Inform all pregnant women about the benefits and management of breastfeeding. Help mothers initiate breastfeeding within 1 hour of birth. Show mothers how to breastfeed and how to maintain lactation even if the baby is separated from them due to illness. Understood? Give newborns no food or drink other than breast milk unless medically indicated for the baby. Practice rooming in, means allowing mother and baby to stay in room together for 24 hours a day. Encourage breastfeeding on demand. Give no artificial teats or pacifiers to the breastfeeding infants. To calm them, we should not give any pacifier. Foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital. This is nothing but baby friendly hospital initiative. Trends in IYCF indicators. If you see, initiation of breastfeeding within 1 hour of birth is, if you see here, 15.8% percentage of children in the age group. If you see 0 to 20, it is increasing actually. Exclusive breastfeeding and complementary feeding rates are increasing properly. Intervention for promoting IVCF practices in health systems are: interventions for providing IVCF are: strengthening of IVCF interventions requires the following three areas of action. That is protection by ensuring implementation of IMS Act, like Infant Milk Substitute Act and Infant Milk Regulation of Production, Supply and Distribution Act 1992 and Amendment Act 2003. Promotion by providing accurate information and skill counseling to all women, family and community members. Support by providing support measures for sustained appropriate feeding through maternity protection. Promoting IVCF practices, other thing is mother and child should have regular contact with the health service provider during pregnancy and the first 2 years of life of child, be it pre or postnatal care and or immunization. Action to be promoting infant and young child feeding have been grouped as following: at hospital facility, during community outreach activities, during community and home-based care. Okay, contact opportunities for promotion of IVCF in the health facility are: during and after institutional delivery, medical officers, staff and ANMs posted at the delivery points are responsible for communication and counseling them and ask them to initiate breastfeeding within 1 hour of life. Understood? Inpatient services for children in stabilization units and special newborn care units. All of them should be encouraged to promote breastfeeding. Okay. Nutritional counselors also should be employed there. Rooming in facilities must be there. Mother and baby should be staying in that room. Outpatient services and consultation for pregnant women, mothers and children. Antenatal clinic, IVCF counseling center and a sick child consultation in the outpatient clinic should be available. Key interventions at community outreach level. MCH, mother and child health contact opportunities during community outreach. Okay, the key responsibility of communication and counseling of mothers caregivers is based on ashas, ANM workers and asha workers, village health and nutrition days, routine immunization days, biannual rounds, IMNCA, and special campaigns for breastfeeding week, and any state specific initiative. Understood? Activities for reaching out to mothers caregivers at the community outreach facilities through growth monitoring sessions, group counseling sessions on a fixed day, fixed time, one-to-one counseling, and display of appropriate information, education, and communication activities with posters. Key intervention during community and home-based visits are postnatal home visits for mobilizing families, growth monitoring and health promotion sessions, and mothers group meetings and self-help group meetings. Activities for reaching out to mother caregivers during home visits and community visits. Okay, the home-based newborn care, that is up to 45 days, that they will have 6 visits to the home to the further sick or low birth weight babies. That is home-based newborn care. IMS Act, that is Infant Milk Substitution Act. We should not provide any artificial formula milks until mother is medically ill and cannot provide mother's milk. Okay, Infant Milk Substitute Feeding Bottles and Infant Foods Act. Okay, this is called as Infant Milk Substitute Feeding Bottles and Infant Foods Act 1992 and amended it in 2003. This act provides for the regulation of production, supply, and distribution of infant milk substitute feeding bottles and infants food with a view to the protection and promotion of breastfeeding and ensuring the proper use of infant foods and for matters connected to it. It extends to the whole of India. It is not to a specific area. It also lays the responsibility of health workers and of the government to provide accurate information to the people. Okay, promote any food by whatever name for children up to 2 years. Promotes use of infant foods before the age of 6 months. Advertises by any means, television, newspapers, magazines, journals, through SMS, emails, radio, and pamphlets is strictly not this one. Okay, should not be given. Distributes the products or samples to any person is not recommended. Contacts pregnant or lactating mothers. Okay, what are the penalties if you don't follow this? Violation of the act attract imprisonment up to 3 months or up to fine up to 5,000. Penalty with regard to the label on container or quality of infant breast milk substitute feeding bottle and infant food is punishable with imprisonment up to 6 months extending to 3 years also, and fine up to at least 2,000 rupees. Okay, and I will message you in the group regarding nutrient composition of certain foods today. Okay, you can read it. It will be useful for your practical purpose also. The certain foods we will keep in the practical in 2 trays. You should be reading all this, read and memorize some of those important things. Okay, I will message you today. Okay, CR.
Yes, sir.
Okay, please read, please go through it. Okay, next class is also pediatrics only today. Okay,
Yes, sir.
okay. Did you able to understand infant and young child feeding to some extent?
Yes, sir.
Okay, fine. Okay, shall we stop here?